Welcome to We're on ECMO, a series for the ECMO community. My guest today is Rachel Wallace, ECMO coordinator at the University of Minnesota Medical Center, a part of M Health Fairview, where she helps lead a busy program that did 308 ECMO runs last year. You may have seen their amazing ECMO ambulance or ECMO truck online. It's a part of their extensive ECPR program. But today I've got Rachel here not to talk about ECPR, but another topic that continues to grow in the ECMO community, and that is mobility. So thank you so much for joining us, Rachel.
Yeah, thanks for having me, Neil. I'm happy to be here.
Good, good. Our team was recently in Minnesota. Some people may have seen your posts about that online, and we were honored to be a part of that. And so, I just wanted to take a little bit of time to talk about mobility and how you plan to use it at your program. And first off, I want to say, what motivated you to partner with EGMO Advantage for a mobility training? What were you trying to accomplish there?
Sure. Actually, about 3 or 4 months ago, my physical therapy liaison came to me and said, "Hey, we really need to start moving our ECMO patients." And at the time, I was like, "Oh, I'm pretty sure we do." And she said, "No, we don't. We really don't." And she was like, "We have a protocol from 2015, and we don't even follow that." So I said, okay, well, let's look into changing it. So we actually took that time to meet as a group. So it was physical therapy and our ECMO staff. And she just showed us our old protocol and she's like, I think we need to do this. And then of course we had a little bit of resistance from our staff that were like, no, no, that's happening, or no, it is happening, or it's not happening. And so I was like, there's places out there that talk about mobility. So I just started to look through some research and find out like who could help us with this.
Hmm.
Most of our clinicians, be it ECMO or nursing or PT and OT, actually have all only worked at the university. So our experience, even though it's great with ECMO, um, isn't a lot when it comes to, outside influence. And
Hmm.
so we saw that you guys had a program that focused on that. And so we debated sending our PT, OT colleagues to ECMO Advantage. And really came down to I really think we need to do it here so we can have more people attend. And then more or less get the background for our ECMO specialists and our nurses to be on board with changing just some ideas around mobility and getting a better handle on it than we do already. So, talked with your team and it just seemed to be a good fit and they were willing to come to Minnesota. They didn't volunteer to come in the winter, but they
Yeah,
came when it was a little bit warmer. I
yeah.
don't think it was that warm. I don't know if you've talked to Myron, but I don't think it was that warm, but it wasn't cold. He
Uh,
definitely asked, he
yeah.
he did ask how cold is it going to be? Um, but really, we just wanted to focus on the whole teamwork
Hmm.
around mobility and how we can get better at it and what we can do to refine our protocol now that we've had this class.
Yeah, that's awesome. Um, what were there any kind of valuable insights that you feel like your team gained in that 2 days that really stand out?
Um, sure. Actually, I was really surprised. We definitely had a level setting. That first day, you guys really took it down to what is ECMO, where are we cannulated, what is it doing? And even though I think, for nursing and ECMO specialists, they had a good handle on it, we also had nursing educators there that maybe haven't really cared for an ECMO patient recently. We had some nursing supervisors, and then physical therapy and occupational therapy, all present. So we kind of just got like the basis of ECMO. And so it was good to kind of level set everyone so everyone knew where we were going to go from there.
Hmm.
And you guys really took it down. Shanna showed us, all the buttons on our cardio help and, just kind of what things we would see and what alarms we would hear. And I think that's really good just to have awareness in the room that this is going to happen when you move a peripherally cannulated patient. And so they really talked us through all that. So I think that was really good to just kind of see like what criteria are we going to do for moving these patients and what are we going to do going forward.
Um, You mentioned several places, all the different disciplines there. How do you feel like that enhanced your training, having that multidisciplinary group in there?
Everyone is super familiar with each other. Our nurses knew all the physical therapists by name and the occupational therapists by name, but it really brought a teamwork environment. Like, there is nothing that you could, that we didn't really know each other as well as we do now to try and work together. I thought we were working together before, and now it's just another level up because we kind of all know where we want to take our program
Hmm.
and where we're going to go from here, but we didn't have that before. And so for M Health to actually step back and give these people 2 days to do a training,
Hmm.
we had 12 to 16 people, depending on the time. Obviously, our medical director also came, and then our CVICU medical director also came. And so we had, times that, they were holding this with value too. And
Hmm.
so to have the whole teamwork environment and like, we're really going to do this and make a protocol that we're going to stick to,
Hmm.
was really evident. And so it was really good to have the buy-in of all the teams present.
Yeah, that the buy-in across the board there is great. I think you guys are fortunate to have that, and if people can get that, and sometimes training helps with that. Like you said, even that level set of getting everybody on the same page, and then everybody kind of going through it together helps create that like vision of where you can go. Um, what was the most challenging aspect of the mobility protocols that your team needed to master, you think?
So, we have been moving patients, but I would say that Erica kind of pushed the limits of what we do. And she really highlighted, like, you can do this, and this is how we're going to do it. So I think something that was good for us was to help us develop guidelines of who we're going to include and who we're going to exclude.
Hmm.
Um, but then going forward, uh, enforcing like a team huddle of what we're going to do before we move the patient, and then identifying like a stop word of when we're
Hmm.
not going to move them anymore, or we're happy with them just standing or sitting at the edge of the bed. So I think those were kind of like things that you take for granted. You're like, well, we're a team and we work together all the time. But
Hmm.
we were really able to just identify other things that we weren't doing, but already felt like we were doing them just
Hmm.
because Erica pointed them out to us. So we were super lucky that she was good at addressing those things and then talking about technique and how we're going to transfer that to the rest of the team.
That's awesome. Were there any like aha moments, like light bulbs that went off during the training that maybe changed kind of just some of the thinking that you guys had?
I think in general, people were surprised. I mean, I shouldn't say that. ECMO specialists in nursing were maybe surprised to hear from a PT perspective that, these patients lose 3% of their muscle loss. Even on full support, we can actually do a lot more with mobility that we weren't doing already. So I
Hmm.
think those were some things that were maybe new to me. Now, I'm not at the bedside every day being the coordinator, but I think hearing from our ECMO specialist and hearing that they said that, like, I didn't realize how deconditioned a patient gets.
Hmm.
So, yes, we do a lot of ECMO here. And in reality, our runs are usually 3 to 5 days. That's not
Hmm.
very much.
Right.
But 3 to 5 days, losing their muscle mass in those 3 to 5 days, that's actually setting them back for a longer ICU stay. So even though they
Hmm.
come off ECMO support, we still have long patient stays. And so I really hope that like even just taking the little tools that we learned, that we can move more patients and hopefully decrease their length of stay.
Yeah. Speaking of length of stay, like what patient outcomes are you hoping to improve, with this new kind of evidence-based
Yeah.
mobility protocols?
Yeah, I think even just looking at that, it's really hard to measure, right? So it's hard to look at ELSO and just grab like that information, like that we're really doing well and getting our patients either to LTAC or home. And
Hmm.
so it'll be good for us to benchmark like how many ICU days they have and where they end up going from here. And actually, part of our team was inviting our quality improvement person. So I rely on this guy every day to like pull numbers with me, make sure my graphs make sense because I present them a lot.
Hmm.
And so having him come to the mobility course as well, so he knew like this is what Rachel's going to be asking me for in the coming weeks to
Hmm.
years. And seeing like, yes, we reduced our ICU stay, our patients are in better condition, more of them went home instead of to LTAC. I think we'll be able to see that change as we implement more protocols. Now, you caught me actually a couple hours before we're meeting as a group, so we haven't even discussed what we learned yet. So
Hmm.
I'm excited to hear what PT and OT took away from our learning.
That's awesome. That's awesome. Um, is there anything like you think move forward is how drastic is the change to workflows? Is it going to fit pretty naturally in what you guys are already doing?
I think it will. And so hearing from physical therapy, um, our rounds tend to get really long with our physicians. And so, one thing that came out of this discussion was can we do mobility rounds earlier in the day? And so, having a physician say, yes, room one is ready to mobilize, room three, maybe not today, um, helps with the physical therapy department just getting their schedule down.
Hmm.
They're busy. And so if they have to mobilize 8 patients that day, they want to set up their day. And if we're not rounding on our ECMO patients until, 10:30, it makes it harder for them to be like fit them in because they know
Hmm.
it's going to be labor intensive to get them moving, especially the first 1 or 2 times to get
Hmm.
them mobilized. And so I think that was good, and we're going to call that out more in our planning group to
Hmm.
make sure that we understand like they need to set up their day so we have success for our patients. So
Hmm.
I don't know if it was Erica from ECMO Advantage that suggested, mobility rounds is kind of what they do at her center. And
Hmm.
so it makes a lot of sense. And we need to adopt some of those habits because we don't have them now.
Great. I think I know the answer to this already based on what you've said, but do you anticipate that this training will impact your patient recovery timelines or rehabilitation outcomes?
Yeah, I think so. I think um I love protocols. We're kind of like definitely strung on protocols here. It gives us more autonomy as ECMO specialists, but it also just makes the team better. Like their assessment skills are brought to another level. I think we'll be able to implement a plan better. We already have a mobility ECMO simulation planned for August. So, I mean, we've set a date, so we have a date to practice,
Hmm.
and then we can invite nurses that weren't able to come to the mobility course, and then other physical therapists and occupational therapists that weren't there, along with ECMO specialists that weren't there. So, I think we have a good plan going forward.
Hmm.
And I hopefully will see a change in 6 months. I don't know what to
Right.
expect with that,
Right. Hmm.
but even just the shared mental model that we can move patients and we can do a better job than we're already doing.
Yeah, that's awesome.
Hmm.
Well, thank you so much for your time. It is always, an honor to be a part and partner with hospitals that really are invested in seeing patients, thrive, not just survive. And so, uh, you guys seem to be always eager and hungry for education and continued learning. And so I'm so thankful that we got connected and that we were able to partner for this training. Excited to see the benchmarks that you guys have set, and all of those things. And when you get some of those numbers in, we'd love to see them. But hopefully, just continue to encourage people with, that there are safe ways and to move patients and to be confident and to do it in a way that hopefully increases those outcomes in a positive way. And so thank you again for your time. If you're watching today and you have questions that you would like to see answered here on We're on ECMO, please reach out to me, Neil, Neil at ECMOadvantage.com, and we'll see you next time.
Thank you.
Bye.